Okay, so now we're doing priority 1, and we're going to start at the lateral occiput. I'm going to go to the inferior nuchal line, inferior lateral nuchal line, and I pressure test lateral to medial. And then after I try and check out if the leg's balanced or not, I would check for clockwise or counterclockwise torque, and then I would adjust straight lateral to medial, like so, with the appropriate torque. And next is lateral sacrum. So I go to the lateral edge of sacrum, pressure test with knife edge, check the legs, and then I would check torque here as well at each individual segment. So I'm going to palpate the segments in S2, S3, and S4. And I would go lateral to medial and superior or posterior to inferior. Yes. Lateral to medial and posterior to anterior, like this. Sorry. At a 45-degree angle. And I'd have it breathe in and out and then focus on the spot, and that's where I would adjust. And after the lateral sacrum is the coccyx. And I would go to the coccyx is what I would do. And I would pressure test like this. Check the legs. There's no torque at coccyx. And then I would find the coccyx, palpate, tissue pull. And this is an inferior to superior, anterior to posterior, making sure I'm as low as possible. And then directly after I go to the sphenoid, she would turn her head, if you will. Pressure test superior to inferior, inferior to superior, anterior to posterior, posterior to anterior. No torque. And then for this one, I'll show, can you turn your head to the side? I'll show anterior to posterior. So go to lateral canthus, a little bit to the side of that. Use my thumb as counter pressure and try to stay in the same line or same plane as her edge of the face, and then that's where I would adjust. You can go back face down. And that is it for priority 1.